Good morning, I'm Dr. Bentwood. I'm here in Meredith, New Hampshire at a health fair put on by Speare Memorial Hospital. And part of this is that it's a colon cancer awareness month. And so we have here a stroll through colon to talk to you about colon diseases and things that you should do to prevent colon cancer. The most important thing that you can do to prevent colon cancer is to have a colonoscopy. And generally, we recommend that you start having that done at about age 50. That's when your risks start increasing significantly. But if you have a family history of colon cancer, certainly you should start earlier at about 40. So keep that in mind. It's actually a very simple procedure. The prep is not terrible, but it's not something you want to go through every day, but it's not bad. And generally, you're sound asleep during the procedure. You don't feel anything. It's quick. You go home right afterwards. There are a few risks, but they're quite low. So you should really pursue that because the advantages far outweigh the risk. It's something you should have done. I've had mine done, just so you know that. And I'm due for one this year, so I'll get it done. So here we are in the walk-through colon. And just so you get a sense, picture this as a long tube, but we're just going to go through a small segment of it. Here we have, as it says, normal colon tissue. The lining of the colon is designed to extract water out of the food you eat. And a normal colon looks like this. You can see the blood vessels through the mucosa or the lining of the colon. And as we go down here, what we often see in people who have a colonoscopy is we see some polyps, a little bump on the lining of the colon. And we have little instruments that we use, and we take biopsies of these and we send them in and have them tested to make sure they're okay. But these are pretty common. A lot of people have colon polyps. And they're usually not serious, but if left alone, a colon polyp can, not always, but can develop into a colon cancer. So you might have multiple colon polyps. You see here a couple together, and we try to destroy those when we do the colonoscopy. We biopsy them, and then we destroy them. And then, as things progress, if left alone, they progress, and you might get multiple polyps that deteriorate into a cancer. So you might find a segment in your colon that if we biopsied this and sent it to the pathologist, they would be able to seek early cancer. And if we find it early, part of your colon can be removed and you can be cured. Colon cancer is definitely curable, but you have to find it early on. Okay, as if it becomes more advanced and spreads, it can spread into your lymphatic stream and into the bloodstream and get to the liver, where it most commonly spreads. That's much more serious, and that's not so easily curable. So here we see an area of the colon that might be an advanced cancer. Sometimes this will extend all around the cancer and actually narrow the colon, and extend all around the colon, and narrow it so that you can get an obstruction of the colon even. That's a more serious problem. But even that can be cured if it hasn't spread yet. So again, the most important thing is to get a colonoscopy. And at least every 10 years, and you just follow the advice of your doctor after you have the procedure. But don't be afraid of it. It's a fairly simple procedure. We do it at multiple colonoscopies every day in the hospital. So look forward to it even. Get it out of your mind so you don't have to worry about it. Good luck to you.